the contractually allowable rate, Medicare, Medicaid, and Oregon Health Plan are paying the full amount. So that's where we're getting the payment in full. So yes, on the side, based on what we normally bill, it looks like a write-off, but when we're only allowed to bill so much to the federal government and they're paying in full what we're billing, that's where we get that number.
Okay, so then your projections, which are exact projections, do they take into account the probability that we're going to write off more than half of these remaining ones that we haven't received the money for? I think that's what the mayor was trying to get at, was we're projecting income even though we don't know that we're going to have to write off maybe 2/3 of what we've billed, and we're still going to get 100% of what, 1/3 of what we build is still 100% collection. So does your expected revenue take into account that we may reduce that amount by over 60% and still collect 100% of what we are entitled to?
Yes, sir, it does. And if you look at, again, the expected return rate, that takes into consideration the projected revenues based on the 7 billable calls that you see before you. The one thing that this spreadsheet does not take into account for is the 911 calls that the paid-on paramedics are able to go on. And
okay, hold on. Let's get back to this though. So this expected revenue is not the total bill of the 4 remaining outstanding calls? Is that what you're saying?
I'm sorry, could you please ask the question again?
The total expected revenue, $9,470.
Yes, sir.
Is that the total amount billed, the outstanding amount billed plus what we've already received? Or is that what we expect to receive?
That's what we expect to receive.
So it's not just these last 3 calls added to what we've already received?
That's what I understand.
Yes, that would be correct.
Okay, so it could be reduced by 60% if those are Medicare calls, isn't that right?
Potentially, but they're
Okay,
not.
but see, that's what we've been asking you, and you've been saying, no, that's not the case. So projected revenue could be reduced by 60%, which would certainly have an impact on the viability of the information we have here. So this is hypothetical entirely, other than the first 4 things.
Well, I think when you take into consideration, well, first and foremost, yes, anytime you're making a projection, it's hypothetical, but these numbers are based on revenue that we brought in over the last 6 years. So it's not, I mean, we're taking into account just these calls, but we're also looking at a 6-year snapshot that, I mean, it basically speaks almost to the T of what we're bringing in. And again, I need to ask the mayor and council to not just focus specifically on these transfers, because there is other revenue that we're generating with the paid-on-call paramedics by covering calls that staff is not able to cover during normal hours.
But we don't have any way of considering that because we don't have the documentation or the information on those calls. So this is what we have to consider this program on right here in front of us. And the fact that the total build doesn't take into account the ledger items above that makes me doubt this entire thing.
What would be more helpful for you?
Well, of these 4 items that we have received payment for, half of them we wrote off 60% of the charges. So just based on the experience of those 4, the following 3 we would expect to write off 60% of the charges, right?
If they were Medicare, but they're not.
They're not? You're certain on that?
I believe one of them might be Medicare, but there's supplemental insurance for one of them, so we kind of have to wait on that.
Don, you have a question?
Yeah, I'm just looking at the cash balance as of, excuse me, the 31st of December of this year, and we show that we have receivables of $96,040.52, and during this period, we did have the paid the help with the ambulance. How did we get so far behind on billing if we had the help? What's going to improve it if we go ahead with the program on farther? What's going to change it?
Well, there's a lot of revenue that's not taken into account from that December 31st number. The city received a check on January 5th for $23,000. I know of another check that the billing company received for $7,500 from a call that happened in 2009, and that was mentioned in the staff report. We also have $20,000 outstanding from Multnomah County through our contract with them that we will be receiving.
No, I'm just talking about, this is, that's in this? It is?
So if you take all those numbers and you put them together, you're looking at $50,000 that we will be receiving within the next couple of months. Definitely $30,000 by the end of this month. And then, again, that doesn't take into all the receipts that we're going to be receiving, the cash that we're going to be receiving between this point and June. So that number that you're seeing there doesn't reflect a lot of revenue that we know is guaranteed to come in.
It'd be hard to run a business like this.
Lance, you have a question?
Yeah, well, first of all, thank you for taking the time to put together this report. When we created the paid on-call position, this was something that the previous council requested, that we have a report halfway through the year on this, on the revenues. So thank you for getting that to us this month. The concern I have, as I shared with you over the phone, and as Kevin has alluded to here, is that when we're considering the viability of this program, it would only be fair to include the 911 calls that the paid on-call paramedics have responded to. But because of the time that it takes to put that into this report, we're not able to consider that tonight because we don't have that. So my question to you is, at what point do you think we will be able to consider that? When will we have that data?
I can shoot for that by the next council meeting. I can do everything I can to try and make that happen.
Because to me, the way I look at it is, until we have that, there's really, we're only getting part of the picture here. And if we're being asked to make a decision tonight on only part of the picture, I mean, it certainly is promising. When you look at the calls that are Medicare billed calls, the calls that are not Medicare billed calls, and our expected return of rate on those just for the transfers, it's promising. And you look at the amount that we've spent on the paid on-call position versus the revenues that we've received just from the transports, yeah, it's a real promising picture. But we also don't have those 911 call response numbers. And to me, that's an important part of the picture that I don't see how it's right for us to make a decision on this position until we have that information. Just, I mean, based on what you're saying, what's included in here, it seems like it would paint a rosier picture. But again, I just wanted to thank you for putting the time into getting into this, into getting this report to us when we asked for it. But it's not, I feel like it's not complete, and I'd like to ask you to bring it back with that data.
I have a question. My understanding was when this position was approved by the council, the council's requested that you give in quarterly reports. It would have been extremely helpful to have these reports quarterly before you finally came up with one today. It just leads to, it leads to wonder. One must wonder what's going on when you don't have a report. So I think that it just needs something that needs to be taken care of. It's like Lance said. I mean, we're going to vote tonight on this, and you should have gave us reports, the quarterly reports that were promised to the council. Is that not a fact?
In terms of promise, that I can't answer because the last that I recalled from, I think maybe it was mentioned at some point, maybe in budget meeting. I don't know if it was a council meeting.
My understanding it was agreed upon at the council meeting that, and I shouldn't have said promised, I should have said required. And it didn't happen. And so it makes it really difficult, just like what Lance said, to try to evaluate things. It's much easier to evaluate them on a step-by-step basis, because then you can see how things are progressing, and you can evaluate it in a good manner. When it's brought on at the last minute, it's not good for everybody to look at this and try to figure it out. If we would have had, and I wasn't on the council prior, but if I would have had reports showing this is how it's going, this is how it's going, and this is how it's going, it would have been much easier to try to do something like this. So, anyway, I just wanted to say that. Go ahead, Tom.
Well, you were talking about voting on it. I'd rather not vote on it tonight. I'd rather spend some more time on it. I think that happened in the last council, is we'd get something and we'd vote on it without kicking around a bit more. Because I believe there are a lot of questions in here. And that's some of the issues I have. Some of the issues that I have in here in the statements and on the spreadsheets is, I don't know about the numbers. It looks to me on some of this stuff, some of the numbers we're using that we want to show on the plus side, we're a little higher on, and some of the on the ones that were on the negative side, we're going a little on to try to sell whatever we, or try to convince that this is the way we should go. Personally, I'm in favor of, I want this program to work. I believe it's a good program for us. I don't believe that in this part in here where we're talking about cutting the salaries of the part-time guys or the on-call people is all right. And same thing, those numbers were right. We showed 3319, which included taxes, but on the low side, we didn't show taxes for the people in the, so we were getting, it was actually about 2975 having Marion, so we're closer to it and all that. But along with that, these guys, they only get paid when they're doing what we want them to do. They're only getting paid to go out on a call. That's important to me. It's important to me that I've got somebody there, and I don't mind paying a little bit more for that, to have that person, because it's, the person that I pay full-time to, we talked about, you have in here in Parkdale, what they're getting paid, they're not including their benefits. As soon as they threw their benefits in there, that 32,000 is gonna go way on up. Sure. You know, and we're not having to do that with these people. These people are coming, and I think they should stay where it is with them. I think because again, they're just on call, somebody full-time, there's a certain amount of time they're going on call, and a certain amount of time they're hanging around. We're paying these people on a call. I mean, we're getting our money's worth, bang, right off. So frankly, I'm good with that price. Some of the other issues that I have with it is what I looked at, and I think what we were trying to get at is we were trying to get better coverage. We didn't want to have to pay you comp time or have to pay you overtime before. We were trying to get overtime down. I don't know where we're at in overtime, but I assume we have overtime, and that's one of the issues that I want to get. I want to get your overtime as tight as I can by using those people that I was looking at. And one of the other issues in here that I have is we've always had, the one person going on that, and now because we have three, there's a certain amount we're sending 3 out on, there's a certain amount we're sending two out on. For me, I want to stretch it on out. I wanted one person going, because that's what we had. And I want to cover the best I can with the one person, spread my money out through the whole thing. When I send 2 or 3, I'm eating my money up in one time out. And I don't like the idea, as a citizen or even on here, that it's appropriate to, because I've got 3 guys, I can send 3 vehicles and charge them 3 vehicles. I don't like that. I think we should be looking at going, if we can use the state guys or the state cop there or whatever, we shouldn't be sending all of our equipment out and charging people. I'd be furious for somebody sending a bunch of stuff out to me so they can make themselves some more money. That's not the direction I wanted this thing to go. I want to have coverage for Cascade locks. I want to make sure there's coverage for Cascade locks. And I think the best way to do it is the part-time people and using a person one at a time, and just doing the best coverage we can out there on the freeway. We can't do it all, we know that. But I wanna make sure we're covered here. I know in the hood, on these here, we're saying, you know, we talked about it in here, that we wanna send one to Hood River and keep one here, because we want to have one at Cascade Lots. But then we go on and say, out on the freeway, we're sending all three of them. So, what we're doing here is backing up with Scandia County and that, which is good. And I think that is where the extra coverage comes from. You know, if that's what Stevenson's there for, that's what Hood River's there for, and that's what we're there for them too, is to back up when we can. So, I would rather spend some more time on it, because I think there are still some issues in here that, and I think some of the money issues need to be looked at better. You talked about, and I don't know how it goes in the industry, but it appears it goes in the industry, is you know you're gonna take a loss, everybody takes that loss. But it appears in the industry, they have an average. After you take a lot of calls, if you do a lot of things, you can come up with a pretty good average. So you should be able to come up with an average of your 88 calls. It shouldn't be a hard thing to do, is to say, out of our losses and all this, we have some that make us 7,000, or one that makes us 7,000, or 11,000, whatever it is. But the true average, because we have some that make us nothing, the true average is 1,000 or 2,000, or whatever that may be. And we should be able to, I'd like to know what that average is, because that helps bring that on in. I personally think it's a doable thing, but I think we need some more, work on how we do it, is my personal opinion. Hey, that's where I'm at on it.
Tiffany?
Actually, I think
Oh, Eva, you have a question?
Go ahead.
Okay.
No, go ahead.
I want to second what Tom said as far as the fact that I would like to not vote on it tonight. I'd like a little bit more information. You talked a little bit about trust and, trying to build that way. I think that if you could provide us with actual income, now that I'm listening to what people are saying, actual income and projected, I think that would be a better picture for everybody. I know that it's work, that's for fun, but I would be comfortable with that. And as far as, I wanted to mention a thing, Tom, safety concerns, is that part of the reason that you're taking other vehicles out on the road? Because that's my understanding, is that safety is kind of one of the reasons that we take more people out on the road. Yes, there's that benefit that you're getting extra income from paramedic units being there, but provide safety and also they can branch off on another call.
Yeah, the first and most important thing for our department is providing safety on the emergency scenes. And a lot of times where we have the multiple paramedics going out are the days where we're getting one wreck after the other, and allows us to split our crew up more efficiently. When we do have the bad weather, we don't have the ability of having ODOT there all the time to provide traffic control, because they're having to mitigate the road conditions. So we have to provide our own traffic control. And in order for us to protect the patient and our responders, we need that equipment out there. We need the extra personnel to be able to coordinate the activities at a scene, especially when you're doing things like ordering helicopters and setting up landing zones and extricating patients out of a car. There's a lot of work that has to happen, so that's why we have the extra vehicles out there, but it's all based on safety and industry standards. And yes, I do understand and agree with you, Mr. Cramlett. We're not in the business of trying to overcharge people. That's never been my intention. I was just saying that it was an added benefit of being able to have the extra personnel on some of those calls, because we don't send 3 paramedics out all the time. It's happened maybe 2 or 3 times over the 6-month period. It's not something we do all the time.
Tiffany?
Marianne, is it an accurate statement do we pay taxes and insurance on the paid on-call position?
You have your normal employment taxes, which is Social Security, Medicare. We pay half, they pay half. That's normal. We pay workers' comp on them. We pay workers' comp for state, workers' comp for our CIS, which is like SAFE, and unemployment insurance. So
And that
just
comes
like
up,
anybody else does, and anybody else that's getting being paid by the city.
And that comes out of the 5,000 or the 10,000?
No,
Becomes-
the eight, there's 10,000 total for this position. And what I had to do is take out all the taxes and put them in the right categories. So actually, the position has a line item, and I want to say $8,900. That is for their gross wage, okay? Then the taxes are figured in totally for the 10,000. So that's where we come up with the $29.75 is what they get paid an hour. With their taxes, it comes out to $33.19. With the city's portion of paying the FICA, the Social Security that I have to pay, then it comes out to $33.19.
I want to say that it was, I agree with Tom that it was not my intention for this position to have the paid on-call position cover the same hours as you work. Although I understand that at times there's most likely a necessity, but the ultimate goal was to cover your non-hours. And it bothers me that we have 3 people responding to 1 call. I think that can be shifted around a lot better. And if we do ask for more information tonight, I would, when the numbers are brought out for the 911 calls, I would like to know the difference between the actual runs and the false alarms. I would all like to see all of that information separated out. This position did start with $5,000, and somehow in the budget process, it got bumped up to $10,000 without going before the council to approve it, except through the budget, as has been stated. And during that budget process, we did ask, it was specifically requested that there be quarterly reports. So somehow in translation, it got lost, but that was, because that is part of the budget minutes, and it was something that I brought up again when we approved the budget for the fiscal year, so yeah, that was part of it.
Lance?
Okay, if I could just ask a question about the issue about 3 paramedics going out on a call, because I can see that perspective. Part of the advantage of having 2 paramedics on call at the same time, including you, would be that one could go out on a call, maybe to the freeway. One would be here to respond to something here in town. So could you just walk us through the decision-making process that would cause more than one paramedic to go out to a call?
Well, you have to remember.
Is that too vague of a question, or are you able to answer that?
No, I think I can take a stab at that one. You have to remember that first and foremost, we're a volunteer agency, and being that we're volunteer, nobody really knows who's going to show up until they show up.
Okay.
So a lot of times, we're having to make decisions on the fly. In order for our paramedics to maintain their credentials, they have to go on calls. So we have to take that into consideration. If we have somebody available and we say, well, you can only take calls during this period of time, and they don't get calls, and they can't keep their skills up, and then they have a hard time maintaining certification. So we have to take that into consideration sometimes if somebody hasn't had very many calls. We need them to get those calls. An example of when we might have sent 2 or 3 out at the same time is when I respond as the incident commander in one vehicle, and you have 1, possibly 2 paramedics in the ambulance, depending on staffing. If we show up on a motor vehicle crash where a patient's entrapped in the vehicle, I need an engine crew to set up traffic control and cut the patient out of the car. And if the patient really is in that bad of a situation and they do have to get cut out, it's a trauma system entry, and we need 2 paramedics in the back, especially when we're doing critical life-saving techniques like paralytic intubation, where we have to control the airway and basically do some pretty crazy things. You need 2 paramedics for that. cardiac arrest calls, we have to have as many paramedics or higher trained EMTs than normal, because we have so many things that have to be done at the same time. We have to start IVs, we have to intubate, we have to deliver electricity, and then deliver drugs.
Could I just interrupt for a second there? Is that okay?
Sure.
So, what would be the difference then if, let's say, the on-call paramedics were not available to take that call, and you were the only paramedic, and you had to deal with that cutting a person out of a car situation? I'm not sure
That's
all
happening.
the terminology you just used, but critical care, I guess, is the best umbrella term I could give it. What would you do in that situation? Wait for one of the, excuse me, one of the Stevenson or Hood River to come down to help, or how would you work through that?
It's really situational dependent. It depends on where in our response area this happens, or if we're responding mutual aid. I actually had a patient die on me right as I cut him out of a car. I had an ambulance coming from Portland. It was right before the Dodson-Warrendale area, and I was it. I was by myself. There was nobody else. So you do the best you can. There are situations where, we've had calls in the middle of the night, and the only people who show up are Carl and myself. So you have two paramedics going on a call, but if I don't show up and Carl doesn't show up, or Carl shows up and nobody else shows up, we can't provide, the medical care that we need to. And a lot of times that's what we've seen happen is, Carl and I going on the call because nobody else shows up.
Don?
I'm listening here, and I'm wondering when are we gonna reach a point where we're not gonna be able to take care of Cascade locks? We started out as a volunteer fire department to take care of Cascade locks. And I personally think it's unfair to use our volunteers to try to make money for the fire department. And it looks like, to me, that's what we're doing now. We're not a volunteer fire department for Cascade locks anymore. We're taking care of the freeway. And when is it gonna get so we're not gonna have anybody for Cascade locks? If I was a volunteer, I think we're hiring some to get paid, and we're asking the others to go out and just do it for practice. When are we gonna get to the point where we can't do it? We can't take care of this unless we get some more help from somewhere. I don't understand how we can keep going the way we are.
Yes.
And that's, from my record, but that's the worst stuff ever, is we've got to make it affordable. Somehow we've got to make the monies all work out, because I'm in favor of something like this going on. And the fact is, we are stuck. We can't save everybody. Even though we want to save everybody, we can't afford to save everybody. And that's what we're stuck at. So my argument is, as long as we can make it affordable, as long as we can do the best we can, we've got to cover Cascade locks, and that's one of the reasons I'm in favor of the on-call people. And I'm hugely in favor of volunteerism, and it sounds like it's growing. It sounds like you're growing out there, your program's going to go. And if we keep growing that program, and it sounds like you got some young people working with you from the paramedic side, that's what I've seen here historically. I remember when Carl and then the group down there were bringing in kids, and now those kids are adults, and believe it, they are making money doing the things that they're learning from those programs. So it does have to be volunteer. You have to have as much volunteer as you can, but the rules have changed for firefighters. The rules have changed for paramedics, and it keeps growing. I believe my belief is the young people, and then everybody else starts getting into it and work at it. But one of our issues my issue is we got to make it affordable, and making it affordable is spreading those people out as much as we can, and that's safety is an issue out there, but the deal is if we can't afford it, we do the best we can. We do the best we can with it. Again, using the volunteers whenever you can to drive the truck and park the truck, not a paramedic. Anytime you can leave the paramedic behind and say, I don't need you, I got a volunteer here who can drive the truck and block traffic, you know, those are the type of things that, those are the type of things I'd like to see, you know, going. The town needs to be covered. I mean, they're the ones footing the bill. Obviously, and that's where you're stuck at, is Jeff would say that we can't afford this whole program without the freeway. The freeway is what helps foot the fire bill. The freeway is what helps foot the paramedics. What I believe we need to keep working for is to get as good a coverage, you know, get the coverage we can in Cascade locks, and do the best we can on the freeway.
As long as the town is first.
Eva?
Don, you mentioned the thing about volunteers. The thing that, I would be interested, if we're gonna talk about volunteers, I think that we should ask the volunteers, or at least a representation of volunteers, where they can be in a non-defensive position to be able to maybe share some of that stuff about, maybe they can share a little bit about their life. So I don't know if that's possible or if we'd be open to that, but having some volunteers that are speaking in a non-defensive position where we're being constructive, looking in the future to do that. That's one thing. Two, I have a question for you. How does the river do their statistics? I mean, did you confer with the river at all? Is it something that we could get, I mean, is their system close enough to our system that we could get a comparison to kind of show, I mean, how are they reflecting their reports?
In terms of,
The same kind of report that you gave us, if you're gonna give us one that shows like actuals compared to projected or average or whatever. How does?
I do not know how Hood River does theirs. What council's asked for is kind of specialized, because we're identifying specific calls. We're not looking at the total picture. Generally, when we're doing reports on revenue and expenditures, we're looking at the whole entire year, or a certain portion of a year. But because of the paid-on-call, we're specifically looking at the calls that the paid-on-call personnel are going on. That's the big difference.
Okay, well, Kevin was next. Go ahead.
Well, I think what's kind of getting lost in the discussion is this program was sold as a self-supporting or a moneymaker program. And that's what we approved. That's what it was approved on the basis of it being a profit center for the ambulance or a self-supporting thing. And we don't have the documentation to support that. And in addition to that, if we go through the audit we got tonight, if we look at the budgeted amounts, this is on page 38, for the emergency services fund, there was a budgeted revenue amount of $171,000. And the income was $125,000 for a deficit of $45,000. And now in this budget, we're talking about transferring about $40,000 from the general fund. Correct me if I'm wrong, Mary Ann.
We don't have to transfer that.
We're not gonna have to transfer that now?
It's too late.
So we can't, but
You can't fix a problem that occurred in the previous year. What we can do.
no, I'm talking about what we're talking about in this current budget cycle, not the previous one.
If the revenues don't increase and come to a proper plus or equal, yes, in June, we will have to do that, so that we do not get the audit hit we got from last year.
Okay.
Yes.
So, and my point is that on the books anyway, this department is in trouble. That it's actually consuming funds from other departments in order to operate. And we're talking about transferring more money into that department to help an additional program when it's not even supporting itself the way it is. And that's what really concerns me, is we're not looking at the whole picture of what's this ambulance service costing the city of Cascade Locks, and what are its actual revenues, and what are we using to support that, and what are we giving up because we're supporting that. These numbers don't even include the replacement of the vehicles, the service on the debt for the fire hall, or any of that stuff. And that's what really concerns me. None of that stuff is addressed. We're picking a little area and saying, well, if we have this on-call person, and we can just pay them for the time that they serve, which I think is a great idea, but we don't consider all of the rest of it, and just look at that one little picture, we're deluding ourselves to think that we're doing a good thing. We need to get control of this debt that's mounting here, and whether it's the stuff not getting billed, or whether we're not getting as much as we expected, or whatever, we're still responsible for this. And the fact that it's $30,000, $40,000, $79,000 behind should concern all of us. I mean, I think that should be the focus of our concern. The paramedic on-call program, I think, is the least of the concerns in this particular department.
Lance, you're next.
Well, I just didn't want to ignore what you also reported to us tonight and in the report about the check that just came in from a call from 2009, I think you said. A check that's been received in Springfield for, that first one you said was $23,000, some change. The $7,000 check that Springfield just received, as well as the outstanding payment from Multnomah County that we expect in the next couple of months. So I didn't want to ignore those by saying that the department's $33,000 in the hole, because those are expected. So I just wanted to make sure that part got brought in. But the reason I raised my hand was just because a couple of comments have been made about protecting Cascade locks first, and using volunteers to go out to the freeway. So I was wondering if you could just comment on that issue in particular, and specifically the question, is protecting City of Cascade locks the first priority of emergency services?
Absolutely, first and foremost. And, you know, I'm happy to report for Councilmember Haight that to this date, we have never missed a call on Cascade locks as a result of us being somewhere else, specifically out on the freeway. We have never missed a call here.
No, I realize it, but it seems to me that we're getting more and more, and I think you'll agree, more and more freeway calls, aren't we? It's getting it's what, 99%, 95% of our calls probably?
No, sir, not even close to that number.
What is it?
I would say it's probably closer to 30 to 40% of our total call volume.
It's outside of the town.
I couldn't say outside of the town, but I could say specifically the freeway. Because outside of the town takes into context when we're responding mutual aid for Skamania County when they call us. That also takes into context when we go to Hood River when they request us for mutual aid. So,
But quite a few times I see outside ambulances coming into town though.
but actually, I'm happy to report that as a result of the paid on call program, that number's decreased. So
But they still do come into town.
very, very infrequently. I think it's been maybe 4 or 5 times in the last 6 months that we've had to have Skamania County come in and help us
See, I
out.
think it should be 0. Maybe I'm asking for too much.
Once a month.
Well, I did go over and talk to him about it, because I know you had concerns of, before we had this program, of whether you could cover enough stuff and they would have to cover too much, and whether we're gonna get into problems with them. And they were a little bit iffy with it, but went over here just last week, and yeah, they say they've got no problems going on here. They've hardly come over. There's very few calls over here right now, so they're feeling good about it. But yeah, they still, but they may not come into our town here. They may come over to do a freeway call too, right?
They have to go to Hood River a lot, and so they do drive through our community quite frequently.
I don't object to it, I'm concerned. Just listening, it sounds like we do a lot of maybe it's not as much as I think, but it's.
Well, that new pavement is what.
Food payment is horrible.
It's terrible.
Here's just one thought, and remember, I don't know about anybody else, but I travel on that freeway a lot. So I kind of considered that Cascade Locks is kind of an extension of me a little bit there. That's just a personal thought there. But I think that I'd like to have more information. I think that you're right, we don't have enough information for the big picture. For me, I'm just coming in on the council, so that's what I would like to see.
So we spent, in the 6 months, it's $5,400 then so we budgeted 5 for it, we're at 54 in the 6, so we're really close
That's
to that.
including taxes. okay? If you just wanna go with the gross pay, it's $4,800. So you've spent a little over half in the 6 months. Yeah, a little over half.
But that's what we're looking at, I think that's what, you know, you were talking about 10, you didn't think it was down to 10 grand, we said 5 grand, we were saying 5 grand for that 6 months, right? I believe, so we're at,
You're a little bit over the
Yeah,
$5,000
okay.
for.
and those guys are covering, you know, the best they can. But we're right in there, we're expecting to.
Kevin?
I believe that there's action required by us to approve expending anything more than $5,000, isn't that correct?
You have
So
already,
we have to take action in order for any of the additional money to be spent.
you have already, because it's already January, have expended into the January cycle. So I would need some type of, and I would think Jeff would want, how we're going to continue this, because we've already spent, I mean, I've already had to pay it on paramedics already for the month of January.
So we're already late.
Well, January is already spent, yes,
Yeah.
But
and that
according
figure I
to,
do not have.
according to the resolution that adopted this program, that it was limited to $5,000 and that council action was required for the additional $5,000 to be spent. Isn't that correct?
I believe that's
That
correct.
there was to be quarterly reports. We approved $5,000 to be spent. For any more than that amount to be spent, required action by the council. I mean, it's in here in this massive paperwork somewhere, I just read it not long ago, but,
I think it was in the motion.
yeah. So, as we sit right now, we're beyond that amount though.
That's correct.
So then the 5,000 that we'd okay was for more than 6 months then, we were saying we're carrying on in June?
No,
We
we're just
agree.
saying that they've
You
spent
just said it's
past
a
the.
400,000, okay.
It was
It was gonna be 5,000 to January though, we got it.
it was up to $5,000,
To January.
quarterly reports, and then
Are
in
we-
January, or when that
Oh,
5,000 was
okay, when
spent,
it's
we were to
spent. Okay,
revisit it.
okay,
Yeah.
okay.
Yeah, the move was, Lorraine moved to approve Fund 5 with the stipulation of a quarterly review and add $5,000 expended from personnel expense for the paid on-call position. That was what it was.
Okay. I would entertain a motion, or Kevin?
Well, the lack of a motion actually kills, the lack of action actually suspends the program.
So we can't go to another if we want, if we want to continue, we need to make a motion. Well, personally, I have a little issue with some of the things that are in here. But I do believe, you know, and I think part of the issue is the whole program, the combination of fire and ambulance, the costs. I think it's the whole program. Because it's the whole program, if we're saying in the whole, it's just not the ambulance in the whole, it's the whole program, it's in the whole. But I truly believe if you look at that $5,000 spent, only that $5 spent, now, you know, everything else could be way out of whack, but that $5,000 spent, the monies that were made from that $5,000 we spent, I think you would see, I think you would see profit in that. So my personal opinion is that program works. There may be other things that aren't working well. We can take a look at those, but personally, so, yeah, I'll make a motion to continue that program. I'll make a motion to put another, what do we need to carry it to June?
Well, if you're gonna meet at the next meeting, which will encompass another payroll, you would have to go until the end of February or after that next meeting.
We'll have to go beyond, but then I have to continue it again. I mean, if I want to continue the
If
thing,
you want to continue the program, you could make a motion to continue the program until the
Okay.
until the $10,000 is gone. Which will
well, I want to
hopefully
continue to
carry
work,
us to
I'll
June.
continue to talk about this, and I want to continue to work on it. So I'd like to make a motion where we continue paying the program until we've had the meetings we need to have to to finish this thing. What do I need, a month or two? I'd like to continue it for 2 months.
Second.
So I need a motion to continue.
Okay, it's been moved by Tom Cramlett and seconded by Lance to extend the current paramedic program for 2 months based, well,
Not based on anything, just continue it.
to continue it, yeah. I wanted to add something.
Now you can have discussion.
Well, you can have an amendment to the motion if it's accepted by the person that made the motion.
Okay. All right, so, anyway, so the motion was moved by Tom and seconded by Lance to extend the paramedic program for 2 months. And was it my understanding so that we could get more information?
Yes.
Okay. All right. All those in favor?
We're gonna have discussion now.
Discussion.
Oh, discussion. Okay, good. Lance?
Well, one of the reasons why I support that motion, what I would suggest as part of discussion, is that within the next month, we have a report that includes some of the things that have been requested tonight, such as the revenue generated by 911 calls that are answered by the paramedic on-call personnel, as well as, I'm not sure if we had enough specificity here, but there's actual versus projected revenues side by side for comparison. And I think there was also someone mentioned, or I think it was Tiffany that talked about actual calls versus false alarm calls. And I think Eva also mentioned some sort of comparison with other, whether it was Hood River or someone else that might be doing the same kind of reports. So, I just wanted to add that as part of discussion, that since those things have been requested, I feel that the purpose of the motion is to get more, is to extend the program for long enough that we can get more information and make a final decision. So I just wanted to share that as my discussion.
Tom?
And I think that we need to do this because part of it's already spent. Yeah, part of this
Okay.
money is already spent, so we have to do
I
something.
have a comment that I would like, I would like to see you, Jeff, work with Mary Ann on this so that it's, you both have had the chance to go through it and come up, is that all right with you, Mary Ann? Can you do that?
Sure.
Thank you. Yes, Kevin?
My concern is that there's been multiple directions and stipulations made, and they haven't been met. And to continue perpetuating that way of doing business doesn't seem right to me. At some point, we're gonna have to address this, and we're approving spending another $5,000 that we're not sure that we have, before we even consider the amount of debt that we have. It doesn't seem reasonable. At some point, we're gonna have to stop and say, how much money do we actually have? Either in the general fund to help support this, the actual money we get into the city of Cascade locks as opposed to what we've billed for. That's really the only thing we consider, is what we have in hand. It's not, we can't sit here and work on projections of, well, we billed this, but it was 6 months after the incident, so we might receive 30% or 90% or whatever. At some point, you gotta stop the bleeding and say, hey, let's take a real look at this and see what we can afford. The statement from the accountant tonight that our reserves, is the way I took it, are dipping, just like every other city, is something we need to consider. We don't necessarily have another $5,000 to invest in something that hasn't proven itself.
Tom?
How do we handle taking care of the money that's been paid out? What can we do tonight to take care of it? Because you've already expended money beyond the fund.
Not our responsibility.
How can we take care of that?
That's not our responsibility. I don't believe that we gave direction as to what was approved to be spent, and money was spent beyond that.
Eva?
I completely understand what you're saying, and I understand from the real rational black and white, I understand that, and, not only understand it, but there's a part of me that feels that way. So I'm gonna go with a little bit though, that I haven't looked at this stuff this way before, and I'm newer, so I'm listening to what you guys say, and I'm also listening to part of what I think the public would say too.
Sure.
Would that be
Sure.
reasonable to say?
Absolutely.
So, I would be in agreement to take that chance of saying, okay, let's just go till the end of February, look at the numbers, and just know for sure. That's right, because if we make the decision tonight, we don't know exactly. So whether we say, if we made the decision tonight and said, nope, we're gonna end the program, or we're going for the program, we never knew. So I like facts, and so I would like to know. And, the thing I hope this is okay to say, but, is it clear our expectation from the council, what we would expect from now and in the future? That basically, the quarterly dues requested that we go through that, even if it's staff.
Sure.
Tom? Oh, sorry, Eva.
No, that's
You done?
okay.
So, and that's where I'm at. I believe in the program. I have issues with other things here. I believe in the program. So what I would like, the information I want if we've had, 6 months, we've got 88 cars, you said, and we've got these things here, I want to compare that against the $5,000. And I don't need to know all the other things we did. I want to know what we did with this, with this program. Where that $5,000 was spent, where it went on a cruise and didn't do anything, and a cruise that did something, I want to know how much that $5,000, that $5,000 made for us. I believe it made us, personally, I believe it made us, so I believe the program is, but I could be wrong. So that's the information I want. I want to compare apples to apples. I want to know, if this, we're talking about this program, we spent $5,400 on it so far in 6 months, and I don't know all the calls those guys went on, and whether we've made money on them, and we should be able to figure that out. Because we do know that when they go out on the call, the same thing here, we're showing these trips to, up to Hood River, where we, the total received was $1,500, but the only expense from the program, well, I guess there would be more expense, but it's the $100 there, $100 to them out of that, okay, we received $1,500, we spent at least $100 to make that $1,500, and then, of course, the ambulance, but the time for a person going up there and doing it is normal, because we're averaging the $100, we're figuring things at 3 hour, that's why with $100, we're figuring things with 3 hours, correct? So most of these times, these guys are averaging around 3 hours, I'm assuming, because that's what we kind of put the thing in. But anyway, compare the trips to
Jeff?
the money out.
It's about $210, a little over $210 when you factor in depreciation, the cost of fuel, the cost of the employee. That's how much it's costing us per run, is about
That doesn't sound
$210.
right to me, though. To me, I'd like to look at that a little more. That number doesn't, I have a hard time. But anyway,
I have one more question. And the one thing that I would truthfully like to see, because it's, everything's an information world. And somehow you've got to get the information to us, and somehow you've got to correct the late billings so that that accounts receivable money is received in a timely manner. So I think as well as you doing that, you should come back with how you're going to fix that problem so that we can be more monthly, so that our curve isn't going like this and it's going more like this. You understand what I'm saying? Okay. Tiffany?
A couple of things. So the motion is to approve it till the end of February? Is that what the motion is? When you say 2 months, you're saying January and February? Is that what you're saying? 2 months?
is that what I need?
By the time you come back to the next meeting, yeah.
Okay, yeah.
The next meeting's in February 7th or 14th, whatever you
All
decide.
right, here's what she's on, right?
And
Can I
then-
address the council?
No.
At no point on this?
No,
We're already past it.
we're past public comment, sorry.
But we,
I
well,
understood public comment was on anything that was not on the agenda.
Yeah,
I'm
we-
sorry.
Exactly.
yeah,
This is on the agenda.
this is on the agenda, so.
So I'd like to-
I'm trying to wait until all the counselors,
Oh, absolutely.
okay? Tiffany, did you have another
No,
question? I'm
no,
sorry.
So I'm confused as to what the motion actually is, to the end of February?
Until the end of
Is that,
February,
is
yeah.
that
End of
for 2
February.
months?
Is there a dollar amount attached to it?
$2,500? I don't know,
No, that's 3
2,000?
months.
No, I want them going out on, I want the program going, so I want them
I
going
don't
on.
have a definite number because they might go out on 4 calls, they might go out on 10 calls. I do not know that number.
Yeah, I want them going on. So,
Well, then how are we gonna know when we get to $10,000?
I will know. I mean, you're $5,400 in 6 months. I don't expect it to go over 2,000 in the next 2 months. I mean,
And
that's a call for Jeff. He knows the call volume and that. I don't know that.
we're coming into our slow season, so when we hit February, March, April, that's when we see a decline in calls. And then once we hit May, June, everything spikes again. So January, maybe beginning of February, depending on the weather, you know, we might see a spike in calls, but it's nothing that's gonna cause this program to go over the 10,000.
What I'm saying is, if we have a $10,000 limit, and we say $2,000 more, isn't it, there's still a maximum amount that could be spent, right?
We have $10,000 on
And when we reach
Budget
10,000,
line item.
when we reach 10,000, we can't spend any more than that. Actually, when we reached 5,000, we couldn't spend any more than that.
that is correct, and that
So if we prove it-
5,000 came during the time of the December where everything
Sure.
totally,
I understand that, but we could potentially spend the other $5,000 in 1 month, right? I mean, it's not likely, but it could happen.
hypothetically, you could,
Okay.
yes.
And then we wouldn't have any money for the rest of this cycle.
That's correct.
Okay, so if we said, we're approving it until February, or $7,000 is reached, it's basically the same thing. There's still a cap.
Yes, you
And
can
you
do
would know
that.
that you reached that cap, just like you would
And
know you reached the
I would
$10,000.
need to monitor the payroll, yes,
Okay,
yes.
so, as an amendment to the motion, I would suggest that there be a monetary cap as well as a time frame. Because the money's gonna have to be monitored either way, how much is being spent.
so how much do I need?
I-
I'll
you're
put that
talking-
in a minute.
Just to clarify, Mr. Benson, that is a cap on gross pay or on the
The
total?
total cost of the program.
Total
That's right.
cost of the program, which includes the taxes?
Absolutely.
Okay.
Because isn't the $10,000 the gross
Yes,
amount?
you just have,
It includes the taxes
that
and
is
everything.
correct, yes,
Okay.
that's correct.
So what, your motion was for how much?
How much do I need?
We're talking about less than,
I would say 2,000 is adequate.
Okay,
I
I'm
don't
going
think
to,
you're gonna have
I'm going
any
to go
more than that.
$2,000 then in two months.
$2,000 cap. All right, is there any other discussion?
Lance, we need to
Lance?
Lance needs to
I'm sorry.
second
So the motion was for 2 months, Kathy?
Yes.
to the end of February.
Is it
Yes, we
the end of February or is it 2 months?
Well, the motion said.
Because the motion was 2 months.
Motion said 2 months.
Okay, and the amendment is 2,000.
$2,000.
Okay. And, I would accept that with the stipulation that the whole purpose of doing this extension is to get more reports within the next month. You know, if it's by February 7th, if that's possible, by then, otherwise it's, was that February 28th? Is that the 4th Monday?
21st.
So to me, I'm accepting it with the understanding that we expect the report back before the end of this extension, so that we can take action at that point based on more concrete data and other things that have been requested as part of this whole discussion.
All right, it's,
Oh, just a little more discussion on it. Just so that we, obviously we're way behind in billing. So we may not necessarily bring the money we made in those 2 months, so. But we still should have an idea of what, same thing, we should have an idea of what our potential is for those.
it's a receivable. Yeah.
Well, just because it's receivable doesn't mean you're gonna make it, just like we had a receivable here, 2,000, we made 700. But I maintain this program, even at that $700, which is a pretty low one, this program, even at that $700, made a few bucks. It went beyond, and that's not great, but even at that, I believe that this program where you're paying somebody only when they go out and do the work. There's some of them, money doesn't come in on some, it comes in, but there is an average that comes in, and I believe that average on this program is gonna be above the expenses. Anyway.
Mr. Mayor, just for the record and to reiterate what's in the report, we're about 2 weeks behind now. We're not months behind in billing.
All right. Is there any other further discussion from the council?
I'll just say something on that too. It's just because you build though, doesn't mean you get the money in. As well, you build the 17,000 or whatever. It took 2 years to get it, so. And that's one of the things that the emergency service, everybody has to understand, that's one of the things they are stuck with. One of the things they're stuck with is they bill somebody, and like I say, it could be an insurance thing, somebody could be fighting this, could be fighting that, and the money doesn't come in, sometimes for months, sometimes for a year, sometimes for 2 years. But I think when you have to run a program like that, that's, your job has to look at, if the money's not coming in, you can't, there's things you gotta cut back on, say, hey, I can't buy that there, or get this here, or whatever, until the money starts coming in again. That's what and I know that's very difficult, but that's what you're stuck with in some things. And that's the difficulty about this, is money may not come in just because you build it for a while. But just remember the accountant did say that the quicker you do it, the better chance you gotta get it back in.
Okay, is there any further discussion from the council? There's been a motion on the floor.
Are we gonna allow public comment?
Oh, you don't approve the motion before you have public comment?
Well, at what point would the public?
I don't know.
Yeah.
Public comment?
I would like to make a public comment, may I?
Yes, you may.
Can I stand up?
Sure you can. Told you to sit down.
I'm sorry, I arrived here late, I was at the school board meeting, and they were talking about closing 2 schools.
Yes, they are.
And, that's a very rash decision. Once you close a school, you can't bring it back. And it's the same thing with this program. This program was really hard fought for.
Just state your name, please.
Oh, my name's Sarah Knight. I'm a resident here in Cascade Lakes. I'm the cookie lady. Okay. I wasn't planning on speaking, but I'd like to say this one thing about medical billing. Everybody is not an expert in every field. Some people are experts in business. Some people are experts in navigation. Some people are experts in carpentry. Everybody's not an expert in every field. I am an expert in medical billing. I did it for 25 years. I trained people. I ran a business. Medical billing, let me use this analogy. When I went to college, they made me take a course on programming a computer. I'm never going to program a computer. They wanted me to take that course because you have to at least know the questions to ask the programmer. You have to at least let them know what you want done. You guys are asking for the snapshot of medical billing. And there's prepaid ambulance services that goes in with that. You have expertise in this field. I would like to see you do a little homework or sit down before council and have some of this knowledge, or ask somebody that does, to explain it to you. Billing, there is a certain amount of write-off, and there is a delay from the time that the monies are received. That's in all medical, every hospital, anybody that does medical billing. My second issue was, the fire department's been a source of pride for this community. And when I hear things like, let's not respond to the freeway, let's put this on a personal note. My sister crashed on the freeway coming to see me. The fire department saved my sister's life. That's the personal note to it. We want tourism in this community. We invite sailors, we invite campers, what's our selling point? Our selling point is we have somebody that can do a trail rescue. We have somebody that can do freeway rescues. It's a source of pride. If this city's hurting that bad for money, I'd like to see a priority of where else we could cut money to save that service. I'd rather pay for it. The people that have historically come up here and addressed this issue that have a personal agenda do not speak for me or for a lot of other people I know. And I commend these people. I love these people. I feel safe in this isolated community for having these people. You cannot go back to a volunteer fire department. There's liability that would cost the city and me as a taxpayer. So if I sound impassioned, it's because I am. And I will fight this cause. Thank you.
Thank you for your comments. Anyone else from the public like to comment on this issue?
I'm going to have a little heart attack.
Don't have a heart attack.
Jeff Helfrich, Cascade Locks. Just, everybody talked about the emotions that go along with this, but we talked, Chief Pritchard talked about extending the olive branch and the communication